Welcome back to Drowsy Tales Daily. Tonight, the people you trusted with your most vulnerable loved ones became predators. Home health aides who stole $1.8 million from seniors. Nursing home administrators who neglected patients for profit. And caregivers who turned golden years into living nightmares. These are the elderly care frauds that will make you guard your grandparents like precious jewels. Our first story takes us to Sarasota, where home health aide Wilhelmina had been providing personal care and assistance for elderly clients throughout the retirement community for 7 years. She was praised by families for her compassionate approach and ability to help seniors maintain independence in their own homes. Wilhelmina seemed genuinely caring and committed to elderly welfare and dignity. Wilhelmina provided wonderful care for my mother and helped her stay in her own home, shared grateful daughter Reginald during a home care evaluation. Her compassionate assistance and reliable service gave our family peace of mind knowing Mom was well cared for. But elderly clients started experiencing financial problems and missing personal items, with Wilhelmina claiming confusion and memory issues that required additional care supervision and protective services to ensure senior safety and financial security. My father's bank accounts are being drained and valuables are missing since Wilhelmina started caring for him, explained concerned son Clementine to Elder Services. She says his dementia causes confusion about money and belongings that requires protective supervision. Investigation revealed Wilhelmina had been deliberately stealing from elderly clients while collecting care fees from families who trusted her assistance, then taking advantage of cognitive impairment to access bank accounts and steal personal property. She'd been using power of attorney documents to withdraw money, stealing jewelry and valuables during care visits, and exploiting elderly confusion to cover financial theft while providing inadequate care. The scheme particularly harmed vulnerable seniors who trusted professional caregiving but faced financial exploitation through systematic theft disguised as confusion management and protective care services. When Elder Services investigated her care practices, they found evidence Wilhelmina had stolen from over 50 elderly clients while collecting care fees and stealing assets exceeding $900,000. Our second story brings us to Phoenix, where nursing home administrator Bartholomew had been managing residential care facilities for elderly residents throughout the valley for 9 years. He was recommended by healthcare organizations and praised by families for his facility management expertise and commitment to quality senior care. Bartholomew seemed genuinely dedicated to elderly welfare and creating safe, comfortable living environments for aging residents. Bartholomew's nursing home provided excellent care for my grandmother and maintained high standards of resident safety, shared satisfied family member Delphine during a facility evaluation. His professional management and caring staff created a wonderful environment that enhanced my grandmother's quality of life and comfort. But families started noticing declining care quality and safety concerns at the facility, with Bartholomew claiming staffing challenges and operational costs that required additional care fees and facility upgrades to maintain quality standards and resident safety. The nursing home care has deteriorated and my grandfather faces safety risks despite paying premium fees, explained worried daughter Genevieve to Healthcare Oversight. Bartholomew says operational challenges require facility upgrades and additional fees to maintain quality care. Investigation revealed Bartholomew had been deliberately reducing care standards while collecting premium fees from families who trusted his facility management, then cutting staff and services to maximize profits while maintaining high pricing for substandard care. He'd been reducing nursing staff, eliminating safety protocols, and providing inadequate medical care while collecting premium pricing for nursing home services designed to maximize profit margins rather than resident welfare. The scheme particularly harmed elderly residents who trusted professional nursing care but faced neglect and safety risks through systematically reduced care standards disguised as operational challenges requiring additional payments. When healthcare licensing authorities investigated his facility practices, they found evidence Bartholomew had reduced care standards affecting over 200 residents while collecting premium fees exceeding $2.3 million. Our third story brings us to Miami, where elderly companion service coordinator Ferdinand had been arranging social support and companionship for isolated seniors throughout South Florida for 5 years. He was recommended by social services and praised by families for his coordination expertise and ability to help lonely elderly clients maintain social connections and emotional well-being. Ferdinand seemed genuinely committed to senior social welfare and preventing elderly isolation through meaningful companionship services. Ferdinand arranged wonderful companionship that helped my mother overcome loneliness and depression, shared grateful son Octavia during a companion service evaluation. His coordination expertise and caring companions provided essential social support that enhanced my mother's emotional well-being and quality of life significantly. But elderly clients started experiencing emotional distress and financial exploitation from companions, with Ferdinand claiming screening challenges and companion training issues that required additional service fees and enhanced supervision to ensure appropriate companionship and senior protection. My father is being emotionally manipulated and financially exploited by the companion Ferdinand arranged, explained distressed daughter Lysander to Elder Protection Services. Ferdinand says companion screening requires enhanced supervision services that cost additional money to ensure senior safety. Investigation revealed Ferdinand had been deliberately placing predatory companions while collecting coordination fees from families who trusted his screening process, then arranging companions who would emotionally manipulate and financially exploit vulnerable elderly clients. He'd been placing companions with criminal backgrounds, providing inadequate screening, and arranging companions who would steal from elderly clients while collecting premium pricing for companion services designed to facilitate elder abuse rather than prevent isolation. The scheme particularly harmed lonely elderly clients who trusted professional companion services but faced emotional manipulation and financial exploitation through deliberately predatory companion placement disguised as social support and companionship coordination. When elder protection licensing authorities investigated his coordination practices, they found evidence Ferdinand had placed predatory companions with over 60 elderly clients while collecting coordination fees exceeding $400,000. Our fourth story brings us to Tampa, where assisted living facility director Horatio had been managing residential communities for seniors requiring daily living assistance throughout Central Florida for 8 years. He was licensed by healthcare authorities and recommended by geriatric specialists for his facility expertise and commitment to maintaining senior independence while providing necessary support services. Horatio seemed genuinely passionate about assisted living and helping seniors maintain dignity while receiving appropriate care assistance. Horatio's assisted living facility provided perfect balance of independence and support for my father, shared appreciative daughter Evangeline during a facility assessment. His management expertise and caring staff helped my father maintain his dignity while receiving necessary assistance with daily activities and healthcare needs. But residents started experiencing inadequate care and safety violations despite paying premium assisted living fees, with Horatio claiming care complexity and regulatory requirements that necessitated additional service fees and facility improvements to maintain assisted living standards and resident safety protocols. My mother faces inadequate care and safety violations despite paying expensive assisted living fees, explained concerned son Archibald to Assisted Living Oversight. Horatio says care complexity requires facility improvements and additional fees to maintain safety standards. Investigation revealed Horatio had been deliberately providing substandard care while collecting premium fees from families who trusted his facility management, then reducing essential services and safety protocols to maximize profits while maintaining expensive pricing for inadequate assisted living care. He'd been reducing medical supervision, eliminating safety monitoring, and providing insufficient daily living assistance while collecting premium pricing for assisted living services designed to maximize profit margins rather than resident care and safety. The scheme particularly harmed elderly residents who trusted professional assisted living but faced inadequate care and safety risks through systematically reduced service standards disguised as operational complexity requiring additional facility improvement payments. When assisted living licensing authorities investigated his facility practices, they found evidence Horatio had provided substandard care to over 150 residents while collecting premium fees exceeding $1.8 million. Our fifth story brings us to Seattle, where geriatric care manager Benedictine had been coordinating healthcare and support services for elderly clients throughout the Pacific Northwest for 6 years. She was certified by care management organizations and recommended by healthcare providers for her coordination expertise and ability to help families navigate complex senior care needs and service arrangements. Benedictine seemed genuinely knowledgeable about geriatric care and committed to helping elderly clients and families access appropriate healthcare and support services. Benedictine coordinated excellent healthcare and support services that enhanced my father's quality of life, shared satisfied son Millicent during a care management evaluation. Her expertise in geriatric care and service coordination provided essential guidance that ensured my father received appropriate medical care and support services for his complex health needs. But elderly clients started receiving inappropriate care and experiencing service coordination failures, with Benedictine claiming healthcare complexity and provider limitations that required additional coordination fees and premium service management to ensure appropriate geriatric care and support service delivery. My mother is receiving inappropriate care and experiencing service failures despite Benedictine's expensive coordination, explained frustrated daughter Prudence to care management oversight. She says healthcare complexity requires premium service management that costs additional money to ensure appropriate care coordination. Investigation revealed Benedictine had been deliberately providing poor care coordination while collecting management fees from families who trusted her expertise, then arranging inappropriate services and health care that would worsen rather than improve elderly client conditions while claiming complexity required additional payments. She'd been arranging inadequate healthcare providers, coordinating inappropriate services, and sabotaging care management while collecting premium pricing for geriatric coordination services designed to create rather than resolve care problems requiring additional service management and coordination enhancement payments. The scheme particularly harmed elderly clients needing complex care who trusted professional geriatric management but faced healthcare deterioration through deliberately poor service coordination disguised as healthcare complexity requiring premium coordination services and care management enhancement. When care management licensing authorities investigated her coordination practices, they found evidence Benedictine had provided poor care coordination for over 80 elderly clients while collecting management fees exceeding $700,000. Our sixth story brings us to Denver, where senior transportation service owner Algernon had been providing medical appointment and essential errand transportation for elderly clients throughout the metropolitan area for 4 years. He was recommended by healthcare providers and praised by families for his transportation expertise and ability to help seniors maintain independence through reliable transportation services. Algernon seemed genuinely committed to senior mobility and helping elderly clients access essential services and healthcare through dependable transportation coordination. Algernon's transportation service helped my mother maintain independence and access healthcare appointments, shared grateful daughter Cordelia during a transportation evaluation. His reliable service and caring drivers provided essential mobility that enhanced my mother's ability to live independently while accessing necessary medical care and services. But elderly clients started experiencing transportation problems and service failures during critical appointments, with Algernon claiming vehicle maintenance issues and driver availability challenges that required additional transportation fees and premium service guarantees to ensure reliable senior transportation and appointment access. My father missed important medical appointments due to transportation failures despite paying for reliable service, explained worried son Maximilian to transportation oversight. Algernon says vehicle issues require premium service guarantees that cost additional money to ensure reliable transportation. Investigation revealed Algernon had been deliberately creating transportation failures while collecting service fees from elderly clients who trusted his mobility assistance, then providing unreliable transportation that would cause seniors to miss medical appointments and essential services. He'd been neglecting vehicle maintenance, providing unreliable drivers, and creating transportation emergencies while collecting premium pricing for senior transportation services designed to create rather than prevent transportation problems requiring additional premium service guarantees and reliability enhancement payments. The scheme particularly harmed elderly clients needing reliable transportation who trusted professional mobility services but faced healthcare access problems through deliberately unreliable transportation disguised as vehicle maintenance challenges, requiring premium service reliability guarantees and transportation enhancement fees. When transportation licensing authorities investigated his service practices, they found evidence Algernon had created transportation failures for over 90 elderly clients while collecting service fees exceeding $300,000. Our seventh story brings us to Atlanta, where memory care specialist Imogene had been providing dementia and Alzheimer's care support for elderly clients and their families throughout the Southeast for 7 years. She was certified by dementia care organizations and recommended by neurologists for her expertise in memory care and ability to help families manage challenging behavioral and cognitive symptoms. Imogene seemed genuinely knowledgeable about memory disorders and committed to helping families navigate difficult dementia care challenges with compassion and professional expertise. Imogene's memory care guidance helped our family manage my mother's Alzheimer's with dignity and understanding, shared grateful son Thaddeus during a memory care evaluation. Her expertise in dementia care and family support provided essential guidance that enhanced our ability to care for my mother while maintaining her dignity and comfort during a difficult journey. But families started experiencing increased behavioral problems and care challenges despite memory care services, with Imogene claiming dementia progression and care complexity that required additional therapy fees and intensive behavioral management to maintain memory care effectiveness and family support coordination. My father's behavioral problems and care challenges increased dramatically after working with Imogene, explained exhausted daughter Wilhelmina to memory care oversight. She says dementia progression requires intensive behavioral management that costs additional money to address increasing care complexity. Investigation revealed Imogene had been deliberately worsening behavioral problems while collecting care fees from families who trusted her memory care expertise, then providing guidance that would increase rather than reduce dementia-related challenges while claiming progression required additional payments for intensive behavioral management and care coordination services. She'd been providing inappropriate behavioral interventions, creating family stress, and sabotaging memory care while collecting premium pricing for dementia care services designed to worsen rather than improve behavioral symptoms requiring additional intensive management and memory care enhancement payments. The scheme particularly harmed families dealing with dementia who trusted professional memory care expertise but faced increased behavioral challenges through deliberately harmful dementia care guidance disguised as disease progression, requiring intensive behavioral management and specialized memory care intervention services. When memory care licensing authorities investigated her care practices, they found evidence Imogene had worsened behavioral problems for over 40 families, while collecting care fees exceeding $600,000. Our eighth story brings us to San Diego, where elderly financial advisor Bartholomew had been providing investment management and financial planning for senior clients throughout Southern California for 9 years. He was licensed by financial planning organizations and recommended by estate attorneys for his expertise in senior financial management and retirement planning strategies. Bartholomew seemed genuinely committed to senior financial security and helping elderly clients protect and manage their assets through appropriate investment strategies and financial planning. Bartholomew's financial planning helped secure my retirement and protect my assets for my family's future, shared confident senior client Delphine during a financial planning evaluation. His expertise in senior financial management provided essential guidance that enhanced my financial security while ensuring my assets would be protected for my children's inheritance. But elderly clients started experiencing investment losses and financial problems despite professional management, with Bartholomew claiming market volatility and economic challenges that required additional management fees and portfolio adjustments to protect senior assets and maintain financial security during uncertain economic conditions. My investment portfolio has lost significant value despite Bartholomew's expensive management services, explained concerned senior Genevieve to financial oversight authorities. He says market challenges require additional portfolio management that costs extra fees to protect my remaining assets. Investigation revealed Bartholomew had been deliberately making poor investment decisions while collecting management fees from elderly clients who trusted his financial expertise, then investing in high-risk ventures that would lose money while claiming market conditions required additional payments for portfolio protection and financial security management. He'd been investing elderly assets in inappropriate high-risk investments, collecting excessive management fees, and creating financial losses while providing false information about market conditions and investment performance to cover systematic financial exploitation of vulnerable senior clients. The scheme particularly harmed elderly investors who trusted professional financial management but faced retirement security destruction through deliberately poor investment decisions disguised as market volatility requiring additional portfolio management, and financial protection services designed to maximize advisor profits rather than protect senior financial security. When financial licensing authorities investigated his investment practices, they found evidence Bartholomew had created investment losses for over 60 elderly clients while collecting management fees and stealing assets exceeding $2.1 million. Our ninth story brings us to Chicago, where senior meal delivery coordinator Ferdinand had been providing nutrition services and meal planning for elderly clients throughout the metropolitan area for 5 years. He was recommended by healthcare providers and praised by families for his nutrition expertise and ability to help seniors maintain proper diet and nutrition through convenient meal delivery services. Ferdinand seemed genuinely committed to senior nutrition and helping elderly clients maintain health and independence through proper dietary support and meal coordination. Ferdinand's meal delivery service helped my father maintain proper nutrition and independence, shared appreciative daughter Octavia during a nutrition service evaluation. His expertise in senior nutrition and convenient meal coordination provided essential dietary support that enhanced my father's health while allowing him to remain in his own home. But elderly clients started experiencing nutritional problems and meal service failures, with Ferdinand claiming dietary complexity and delivery challenges that required additional nutrition fees and premium meal services to ensure appropriate senior nutrition and dietary support coordination. My mother is experiencing nutritional problems and meal delivery failures despite paying for reliable nutrition services, explained concerned son Lysander to nutrition oversight authorities. Ferdinand says dietary complexity requires premium meal services that cost additional money to ensure proper senior nutrition. Investigation revealed Ferdinand had been deliberately providing poor nutrition services while collecting meal fees from elderly clients who trusted his dietary expertise, then delivering inadequate meals and nutritional support that would worsen rather than improve senior health and dietary needs. He'd been providing meals with poor nutritional value, delivering spoiled food, and creating dietary problems while collecting premium pricing for senior nutrition services designed to create rather than prevent nutritional problems requiring additional premium meal services and dietary support enhancement payments. The scheme particularly harmed elderly clients needing proper nutrition who trusted professional meal delivery but faced health deterioration through deliberately inadequate nutrition services disguised as dietary complexity requiring premium meal coordination and nutritional support enhancement services designed to maximize profits rather than maintain senior health and dietary well-being. When nutrition services licensing authorities investigated his meal coordination practices, they found evidence Ferdinand had provided inadequate nutrition services to over 100 elderly clients while collecting meal fees exceeding $500,000. Our 10th story brings us to Las Vegas, where senior housing specialist Horatio had been helping elderly clients find appropriate housing and residential care options throughout Nevada for 6 years. He was recommended by real estate professionals and praised by families for his housing expertise and ability to help seniors transition to appropriate living arrangements that met their changing needs and care requirements. Horatio seemed genuinely knowledgeable about senior housing and committed to helping elderly clients find safe, appropriate, and affordable residential options for their changing life circumstances. Horatio helped my mother find perfect senior housing that met her needs and budget, shared satisfied daughter Evangeline during a housing consultation evaluation. His expertise in senior residential options provided essential guidance that enhanced my mother's living situation while ensuring she received appropriate care and support in a safe environment. But elderly clients started experiencing housing problems and residential care failures, with Horatio claiming housing market challenges and facility limitations that required additional consulting fees and premium housing services to secure appropriate senior residential options and care facility placement. My father is experiencing housing problems and care failures despite Horatio's expensive housing consultation, explained frustrated son Archibald to Senior Housing Oversight. He says housing market challenges require premium placement services that cost additional money to secure appropriate senior housing. Investigation revealed Horatio had been deliberately arranging inappropriate housing while collecting consultation fees from elderly clients who trusted his housing expertise, then placing seniors in facilities with known problems while claiming housing limitations required additional payments for premium placement services and residential care coordination. He'd been placing elderly clients in facilities with safety violations, arranging housing with inadequate care, and creating residential problems while collecting premium pricing for senior housing services designed to create rather than prevent housing problems, requiring additional premium placement services and residential care enhancement coordination. The scheme particularly harmed elderly clients needing appropriate housing who trusted professional residential consultation but faced unsafe living conditions through deliberately inappropriate housing placement disguised as market limitations, requiring premium placement services and residential care coordination designed to maximize consultation profits rather than ensure senior housing safety and care adequacy. When senior housing licensing authorities investigated his placement practices, they found evidence Horatio had arranged inappropriate housing for over 70 elderly clients while collecting consultation fees exceeding $400,000. Our 11th story brings us to Portland, where elderly medication management specialist Benedictine had been providing prescription coordination and medication safety services for senior clients throughout the Pacific Northwest for 8 years. She was certified by pharmacy organizations and recommended by healthcare providers for her expertise in senior medication management and ability to help elderly clients safely manage complex prescription regimens. Benedictine seemed genuinely committed to medication safety and helping seniors avoid dangerous drug interactions and medication errors through professional prescription coordination and safety monitoring. Benedictine's medication management helped my father safely manage his complex prescriptions, shared grateful son Millicent during a medication safety evaluation. Her expertise in prescription coordination provided essential safety monitoring that prevented dangerous drug interactions while ensuring my father received appropriate medication therapy for his health conditions. But elderly clients started experiencing medication problems and adverse drug reactions despite professional management, with Benedictine claiming prescription complexity and drug interaction challenges that required additional management fees and intensive medication monitoring to ensure senior prescription safety and therapeutic effectiveness. My mother is experiencing medication problems and adverse reactions despite Benedictine's expensive management services, explained worried daughter Prudence to medication safety oversight. She says prescription complexity requires intensive monitoring that costs additional money to ensure medication safety. Investigation revealed Benedictine had been deliberately creating medication problems while collecting management fees from elderly clients who trusted her prescription expertise, then providing medication coordination that would cause rather than prevent dangerous drug interactions and adverse reactions. She'd been recommending inappropriate medication combinations, providing incorrect dosage guidance, and creating prescription problems while collecting premium pricing for medication management services designed to create rather than prevent medication safety problems, requiring additional intensive monitoring and prescription coordination enhancement services. The scheme particularly harmed elderly clients needing medication safety who trusted professional prescription management but faced health risks through deliberately dangerous medication coordination disguised as prescription complexity, requiring intensive monitoring and medication safety enhancement services designed to maximize management profits rather than ensure senior prescription safety and therapeutic effectiveness. When medication management licensing authorities investigated her coordination practices, they found evidence Benedictine had created medication problems for over 50 elderly clients while collecting management fees exceeding $300,000. Our 12th story brings us to Houston, where senior legal services attorney Algernon had been providing estate planning and legal advocacy for elderly clients throughout Southeast Texas for 7 years. He was licensed by state bar associations and recommended by elder law organizations for his expertise in senior legal issues and ability to help elderly clients protect their rights and assets through appropriate legal planning and advocacy. Algernon seemed genuinely committed to elder law and helping seniors navigate complex legal challenges while protecting their interests and family assets through professional legal representation and estate planning services. Algernon's legal services helped protect my estate and ensure my family's financial security, shared confident senior client Cordelia during a legal consultation evaluation. His expertise in elder law provided essential legal protection that enhanced my peace of mind while ensuring my assets would be properly managed and distributed according to my wishes. But elderly clients started experiencing legal problems and asset losses despite professional representation. with Algernon claiming legal complexity and estate challenges that required additional legal fees and intensive advocacy services to protect senior rights and ensure appropriate asset protection and estate planning effectiveness. My estate planning created legal problems and asset losses despite Algernon's expensive legal services, explained devastated senior Maximilian to legal oversight authorities. He says legal complexity requires intensive advocacy that costs additional money to protect my remaining assets and family interests. Investigation revealed Algernon had been deliberately creating legal problems while collecting attorney fees from elderly clients who trusted his legal expertise, then providing legal advice that would harm rather than protect senior interests while claiming complexity required additional payments for intensive advocacy and legal protection services. He'd been creating defective estate plans, providing poor legal advice, and sabotaging asset protection while collecting premium pricing for elder law services designed to create rather than prevent legal problems requiring additional intensive advocacy and estate planning enhancement services designed to maximize legal fees rather than protect senior rights and family assets. The scheme particularly harmed elderly clients needing legal protection who trusted professional elder law expertise but faced asset losses and legal complications through deliberately harmful legal representation disguised as estate complexity, requiring intensive advocacy and legal protection enhancement services. When legal licensing authorities investigated his representation practices, they found evidence Algernon had created legal problems for over 40 elderly clients while collecting attorney fees exceeding $800,000. Our 13th story brings us to Phoenix, where senior technology support specialist Imogene had been helping elderly clients learn and use technology for communication and daily activities throughout the valley for 4 years. She was recommended by technology organizations and praised by families for her expertise in senior technology education and ability to help elderly clients safely use computers and digital devices for social connection and practical assistance. Imogene seemed genuinely committed to digital inclusion and helping seniors overcome technology barriers through patient instruction and appropriate technology support designed for elderly users and their specific needs and limitations. Imogene's technology support helped my mother learn to use video calling to stay connected with family, shared grateful daughter Thaddeus during a technology education evaluation. Her patient instruction and senior-focused approach provided essential digital skills that enhanced my mother's social connections while helping her maintain relationships with distant family members through technology. But elderly clients started experiencing technology problems and digital security issues despite professional support, with Imogene claiming technology complexity and security challenges that required additional support fees and premium protection services to ensure senior digital safety and technology effectiveness for elderly users. My father is experiencing technology problems and security issues despite Imogene's expensive support services, explained concerned son Wilhelmina to technology oversight authorities. She says technology complexity requires premium protection services that cost additional money to ensure digital safety. Investigation revealed Imogene had been deliberately creating technology problems while collecting support fees from elderly clients who trusted her digital expertise, then providing technology assistance that would expose seniors to security risks and digital problems, while claiming complexity required additional payments for premium protection and technology enhancement services. She'd been installing problematic software, exposing elderly clients to security risks, and creating technology problems while collecting premium pricing for senior technology services designed to create rather than prevent digital problems requiring additional premium protection and technology safety enhancement services. The scheme particularly harmed elderly clients seeking digital inclusion who trusted professional technology support but faced security risks and digital problems through deliberately harmful technology assistance disguised as complexity requiring premium protection and technology safety enhancement services designed to maximize support profits rather than ensure senior digital safety and technology effectiveness. When technology support licensing authorities investigated her assistance practices, they found evidence Imogene had created technology problems for over 60 elderly clients while collecting support fees exceeding $200,000. Our 14th story brings us to Miami, where elderly social services coordinator Bartholomew had been connecting senior clients with community resources and support services throughout South Florida for 9 years. He was recommended by social service agencies and praised by families for his coordination expertise and ability to help elderly clients access appropriate community support and government assistance programs for senior needs and welfare enhancement. Bartholomew seemed genuinely committed to senior welfare and helping elderly clients navigate complex social service systems to access essential support and community resources for maintaining independence and quality of life during aging challenges. Bartholomew helped my mother access community resources that enhanced her independence and quality of life, shared appreciative daughter Delphine during a social services evaluation. His expertise in senior services coordination provided essential guidance that connected my mother with appropriate support while helping her maintain her dignity and independence in her own community. But elderly clients started losing benefits and experiencing service coordination failures, with Bartholomew claiming bureaucratic challenges and program limitations that required additional coordination fees and premium advocacy services to ensure senior access to community resources and government assistance programs. My father lost benefits and experienced service failures despite Bartholomew's expensive coordination services, explained frustrated son Genevieve to social services oversight. He says bureaucratic challenges require premium advocacy that costs additional money to secure community resources and government assistance. Investigation revealed Bartholomew had been deliberately sabotaging benefit applications while collecting coordination fees from elderly clients who trusted his social services expertise, then providing coordination that would result in benefit loss and service failures, while claiming bureaucratic complexity required additional payments for premium advocacy and service coordination enhancement. He'd been filing incorrect benefit applications, providing false information to social service agencies, and sabotaging community resource access, while collecting premium pricing for social services coordination designed to create rather than prevent benefit problems requiring additional premium advocacy and service coordination enhancement services. The scheme particularly harmed elderly clients needing community support who trusted professional social services coordination but faced benefit loss and service failures through deliberately harmful coordination disguised as bureaucratic complexity, requiring premium advocacy and social services enhancement designed to maximize coordination profits rather than ensure senior access to community resources and government assistance programs. When social services licensing authorities investigated his coordination practices, they found evidence Bartholomew had sabotaged benefit applications for over 80 elderly clients while collecting coordination fees exceeding $400,000. Our 15th story brings us to Boston, where senior fitness instructor Ferdinand had been providing exercise programs and physical therapy support for elderly clients throughout New England for 5 years. He was certified by fitness organizations and recommended by healthcare providers for his expertise in senior fitness and ability to help elderly clients maintain mobility and physical health through appropriate exercise programs designed for aging bodies and health limitations. Ferdinand seemed genuinely committed to senior physical wellness and helping elderly clients maintain strength and mobility through safe, effective exercise programs that accommodated age-related physical changes and health considerations for optimal senior fitness and wellness outcomes. Ferdinand's fitness program helped my father maintain strength and mobility that enhanced his independence, shared satisfied daughter Octavia during a senior fitness evaluation. His expertise in senior exercise and physical wellness provided essential fitness support that improved my father's physical health while helping him maintain his ability to live independently and enjoy daily activities. But elderly clients started experiencing injuries and physical problems despite fitness training, with Ferdinand claiming exercise complexity and health challenges that required additional training fees and intensive physical therapy to ensure senior fitness safety and exercise effectiveness for elderly participants with complex health conditions. My mother suffered injuries and physical problems after participating in Ferdinand's fitness program, explained worried son Lysander to fitness oversight authorities. He says exercise complexity requires intensive physical therapy that costs additional money to address injury risks and ensure fitness safety. Investigation revealed Ferdinand had been deliberately creating exercise injuries while collecting training fees from elderly clients who trusted his fitness expertise. then providing exercise programs that would cause rather than prevent physical problems while claiming complexity required additional payments for intensive physical therapy and fitness safety enhancement services. He'd been designing inappropriate exercise programs, pushing elderly clients beyond safe limits, and creating fitness injuries while collecting premium pricing for senior fitness services designed to create rather than prevent physical problems requiring additional intensive therapy and exercise safety enhancement services. The scheme particularly harmed elderly clients seeking physical wellness who trusted professional fitness expertise but faced injuries and physical deterioration through deliberately harmful exercise programs disguised as complexity, requiring intensive therapy and fitness safety enhancement designed to maximize training profits rather than ensure senior physical wellness and exercise safety. When fitness licensing authorities investigated his training practices, they found evidence Ferdinand had created exercise injuries for over 70 elderly clients while collecting training fees exceeding $300,000. Our 16th story brings us to Seattle, where elderly insurance consultant Horatio had been helping senior clients navigate healthcare coverage and insurance options throughout the Pacific Northwest for 6 years. He was licensed by insurance organizations and recommended by healthcare providers for his expertise in senior insurance needs and ability to help elderly clients secure appropriate coverage for their changing health and financial circumstances. Horatio seemed genuinely knowledgeable about senior insurance and committed to helping elderly clients find affordable, comprehensive coverage that met their healthcare needs while protecting their financial security during aging challenges and medical expenses. Horatio helped me find perfect insurance coverage that protected my health and finances, shared grateful senior client Evangeline during an insurance consultation evaluation. His expertise in senior insurance options provided essential guidance that secured appropriate healthcare coverage while ensuring I could afford necessary medical care without depleting my retirement savings. But elderly clients started experiencing coverage problems and insurance claim denials despite professional consultation, with Horatio claiming insurance complexity and coverage limitations that required additional consulting fees and premium advocacy services to ensure senior insurance effectiveness and claim resolution for healthcare coverage disputes and medical expense protection. My insurance coverage has major problems and claims are being denied despite Horatio's expensive consultation, explained frustrated senior Archibald to insurance oversight authorities. He says insurance complexity requires premium advocacy that costs additional money to resolve coverage problems and ensure claim approval. Investigation revealed Horatio had been deliberately recommending inappropriate insurance while collecting consulting fees from elderly clients who trusted his coverage expertise, then providing insurance guidance that would result in coverage gaps and claim denials, while claiming complexity required additional payments for premium advocacy and insurance resolution services. He'd been recommending insurance policies with inadequate coverage, providing false information about policy benefits, and creating insurance problems while collecting premium pricing for senior insurance services designed to create rather than prevent coverage problems requiring additional premium advocacy and insurance enhancement services. The scheme particularly harmed elderly clients needing healthcare coverage who trusted professional insurance expertise but faced medical expense exposure through deliberately inappropriate insurance recommendations disguised as coverage complexity, requiring premium advocacy and insurance resolution designed to maximize consultation profits rather than ensure senior healthcare coverage and financial protection. When insurance licensing authorities investigated his consultation practices, they found evidence Horatio had recommended inappropriate insurance for over 50 elderly clients while collecting consulting fees exceeding $600,000. Our 17th story brings us to Denver, where senior home modification contractor Benedictine had been adapting homes for aging in place and accessibility improvements throughout the Rocky Mountain region for 8 years. She was recommended by occupational therapists and praised by families for her expertise in senior home safety and ability to help elderly clients modify their homes for continued independence and safety during aging challenges. Benedictine seemed genuinely committed to aging in place and helping seniors maintain independence through appropriate home modifications and accessibility improvements designed for elderly safety and comfort in familiar home environments. Benedictine's home modifications helped my mother safely remain in her own home, shared grateful son Millicent during a home modification evaluation. Her expertise in senior accessibility provided essential safety improvements that enhanced my mother's independence while reducing fall risks and maintaining her comfort in her familiar home environment. But elderly clients started experiencing home modification problems and safety issues despite professional services, with Benedictine claiming modification complexity and building challenges that required additional construction fees and premium safety upgrades to ensure senior home safety and accessibility effectiveness for aging-in-place success. My father's home modifications created safety problems and accessibility failures despite Benedictine's expensive services, explained concerned daughter Prudence to Home Modification Oversight. She says modification complexity requires premium safety upgrades that cost additional money to ensure home accessibility and safety. Investigation revealed Benedictine had been deliberately creating home safety problems while collecting modification fees from elderly clients who trusted her accessibility expertise, then providing home modifications that would create rather than prevent safety hazards while claiming complexity required additional payments for premium safety upgrades and accessibility enhancement services. She'd been installing defective safety equipment, creating accessibility barriers, and sabotaging home modifications while collecting premium pricing for senior home modification services designed to create rather than prevent safety problems requiring additional premium upgrades and home safety enhancement services. The scheme particularly harmed elderly clients seeking home safety, who trusted professional modification expertise but faced increased safety risks through deliberately harmful home modifications disguised as complexity, requiring premium safety upgrades and accessibility enhancement designed to maximize construction profits rather than ensure senior home safety and aging-in-place success. When home modification licensing authorities investigated her construction practices, they found evidence Benedictine had created home safety problems for over 40 elderly clients while collecting modification fees exceeding $500,000. Our 18th story brings us to Tampa, where elderly daycare center director Algernon had been providing adult day services and social activities for seniors throughout Central Florida for 7 years. He was licensed by healthcare authorities and recommended by families for his daycare expertise and ability to provide safe, engaging activities that enhanced elderly socialization and provided family caregiver relief. Algernon seemed genuinely committed to senior daycare and helping elderly clients maintain social connections while providing families with necessary respite care and professional supervision for aging relatives with increasing care needs and social isolation challenges. Algernon's daycare center provided wonderful social activities that enhanced my father's quality of life, shared appreciative daughter Cordelia during a daycare evaluation. His expertise in senior activities and professional supervision provided essential social engagement that reduced my father's isolation while giving our family needed respite and peace of mind about his daily care and safety. But elderly clients started experiencing neglect and safety problems at the daycare facility, with Algernon claiming staffing challenges and activity limitations that required additional daycare fees and premium supervision services to ensure senior safety and social engagement effectiveness for elderly participants with complex care needs and behavioral challenges. My mother experienced neglect and safety problems at the daycare despite paying premium fees, explained worried son Maximilian to daycare oversight authorities. Algernon says staffing challenges require premium supervision that costs additional money to ensure senior safety and appropriate care. Investigation revealed Algernon had been deliberately providing inadequate supervision while collecting daycare fees from families who trusted his senior care expertise, then reducing staff and safety protocols to maximize profits while maintaining expensive pricing for substandard daycare services designed to create rather than prevent neglect and safety problems requiring additional premium supervision and care enhancement services. He'd been reducing daycare staff, eliminating safety monitoring, and providing inadequate activity supervision while collecting premium pricing for senior daycare services designed to maximize profit margins rather than ensure elderly safety and social engagement. The scheme particularly harmed elderly clients needing safe daycare who trusted professional supervision but faced neglect and safety risks through systematically reduced care standards disguised as staffing challenges requiring premium supervision and daycare enhancement services designed to maximize profits rather than ensure senior safety and social engagement quality. When daycare licensing authorities investigated his facility practices, they found evidence Algernon had provided inadequate supervision affecting over 100 elderly clients while collecting daycare fees exceeding $700,000. Our 19th story brings us to Atlanta, where senior placement consultant Imogene had been helping families find appropriate care facilities and residential options for elderly relatives throughout the Southeast for 4 years. She was recommended by healthcare providers and praised by families for her placement expertise and ability to help families navigate complex care facility selection and placement decisions for aging relatives with increasing care needs. Imogene seemed genuinely knowledgeable about senior care facilities and committed to helping families find appropriate placement that met elderly clients' medical needs while ensuring family satisfaction and peace of mind. Imogene helped us find the perfect care facility that met my mother's complex needs, shared grateful daughter Thaddeus during a placement consultation evaluation. Her expertise in facility selection provided essential guidance that ensured my mother received appropriate care while giving our family confidence in our placement decision. But families started discovering placement facilities had serious problems and inadequate care, with Imogene claiming facility limitations and care complexity that required additional consulting fees and premium placement services to secure appropriate senior care facilities and residential options for elderly clients with complex medical and social needs. My father's placement facility has serious problems and inadequate care despite Imogene's expensive consultation, explained frustrated son Wilhelmina to placement oversight authorities. She says facility limitations require premium placement services that cost additional money to secure appropriate senior care. Investigation revealed Imogene had been deliberately placing elderly clients in inappropriate facilities while collecting consulting fees from families who trusted her placement expertise, then arranging placements in facilities with known violations and care problems, while claiming limitations required additional payments for premium placement and facility enhancement services. She'd been placing elderly clients in facilities with safety violations, arranging placements with inadequate medical care, and creating residential problems while collecting premium pricing for senior placement services designed to create rather than prevent care facility problems requiring additional premium placement and facility selection enhancement services. The scheme particularly harmed elderly clients needing appropriate placement who trusted professional consultation but faced inadequate care through deliberately inappropriate facility placement disguised as limitations requiring premium placement and facility enhancement designed to maximize consultation profits rather than ensure senior care quality and family satisfaction. When placement consulting licensing authorities investigated her placement practices, they found evidence Imogene had arranged inappropriate placements for over 60 elderly clients while collecting consulting fees exceeding $400,000. Our 20th story brings us to Phoenix, where elderly estate planning specialist Bartholomew had been helping senior clients protect assets and plan inheritance distribution throughout the valley for 9 years. He was licensed by estate planning organizations and recommended by elder law attorneys for his expertise in senior asset protection and ability to help elderly clients preserve wealth while ensuring appropriate inheritance planning for family financial security. Bartholomew seemed genuinely committed to estate planning and helping seniors protect their life's work through appropriate asset management and inheritance strategies designed to benefit families while minimizing tax liability and legal complications. Bartholomew's estate planning helped protect my assets and ensure my family's financial security, shared confident senior client Delphine during an estate planning evaluation. His expertise in asset protection provided essential planning that preserved my wealth while ensuring my children would receive appropriate inheritance without legal complications or excessive taxation. But elderly clients started experiencing asset losses and estate problems despite professional planning, with Bartholomew claiming legal complexity and estate challenges that required additional planning fees and intensive asset protection services to ensure senior wealth preservation and inheritance planning effectiveness for complex family situations and changing legal requirements. My estate planning created asset losses and legal problems despite Bartholomew's expensive services, explained devastated senior Genevieve to estate planning oversight. He says legal complexity requires intensive asset protection that costs additional money to preserve my remaining wealth and family inheritance. Investigation revealed Bartholomew had been deliberately creating estate problems while collecting planning fees from elderly clients who trusted his asset protection expertise, then providing estate planning that would result in asset losses and inheritance complications while claiming complexity required additional payments for intensive protection and estate enhancement services. He'd been creating defective estate plans, recommending inappropriate asset transfers, and sabotaging inheritance planning, while collecting premium pricing for estate planning services designed to create rather than prevent asset problems requiring additional intensive protection and estate planning enhancement services. The scheme particularly harmed elderly clients seeking asset protection who trusted professional estate planning but faced wealth destruction through deliberately harmful estate planning disguised as legal complexity requiring intensive protection and estate enhancement designed to maximize planning profits rather than preserve senior assets and family inheritance security. When estate planning licensing authorities investigated his planning practices, they found evidence Bartholomew had created estate problems for over 30 elderly clients while collecting planning fees exceeding $1.5 million. Our 21st story brings us to San Diego, where senior mobility equipment specialist Ferdinand had been providing wheelchairs, walkers, and assistive devices for elderly clients throughout Southern California for 5 years. He was recommended by physical therapists and praised by families for his equipment expertise and ability to help seniors maintain mobility and independence through appropriate assistive devices and mobility equipment designed for aging challenges and physical limitations. Ferdinand seemed genuinely committed to senior mobility and helping elderly clients maintain independence through quality equipment and professional fitting services that enhanced safety and comfort during daily activities and movement challenges. Ferdinand provided excellent mobility equipment that helped my father maintain independence, shared satisfied daughter Octavia during a mobility equipment evaluation. His expertise in assistive devices provided essential mobility support that enhanced my father's safety while allowing him to continue daily activities with confidence and dignity. But elderly clients started experiencing equipment failures and mobility problems despite professional services, with Ferdinand claiming equipment complexity and maintenance challenges that required additional service fees and premium equipment upgrades to ensure senior mobility effectiveness and assistive device reliability for elderly users with complex physical needs. My mother's mobility equipment keeps failing and creating safety problems despite Ferdinand's expensive services, explained worried son Lysander to mobility equipment oversight. He says equipment complexity requires premium upgrades that cost additional money to ensure mobility safety and device reliability. Investigation revealed Ferdinand had been deliberately providing defective equipment while collecting service fees from elderly clients who trusted his mobility expertise, then selling equipment that would fail and create safety hazards while claiming complexity required additional payments for premium upgrades and equipment enhancement services. He'd been selling refurbished equipment as new, providing devices with known defects, and creating mobility problems while collecting premium pricing for senior mobility services designed to create rather than prevent equipment problems requiring additional premium upgrades and mobility enhancement services. The scheme particularly harmed elderly clients needing mobility assistance who trusted professional equipment expertise but faced safety risks through deliberately defective mobility equipment disguised as complexity requiring premium upgrades and equipment enhancement designed to maximize equipment profits rather than ensure senior mobility safety and independence. When mobility equipment licensing authorities investigated his service practices, they found evidence Ferdinand had provided defective equipment to over 80 elderly clients while collecting service fees exceeding $300,000. Our 22nd story brings us to Chicago, where elderly home health agency director Horatio had been coordinating nursing care and medical services for senior clients throughout the metropolitan area for 8 years. He was licensed by healthcare authorities and recommended by physicians for his agency expertise and ability to provide quality home health care that allowed elderly clients to receive medical care while remaining in familiar home environments. Horatio seemed genuinely committed to home health care and helping seniors receive appropriate medical care through professional nursing services and healthcare coordination designed to maintain independence while ensuring proper medical supervision and treatment. Horatio's home health agency provided excellent nursing care that allowed my mother to remain at home, shared grateful son Evangeline during a home healthcare evaluation. His expertise in medical care coordination provided essential healthcare services that maintained my mother's health while allowing her to stay in her familiar home environment with dignity and comfort. But elderly clients started receiving inadequate medical care and experiencing health complications despite professional services. With Horatio claiming healthcare complexity and nursing challenges that required additional care fees and intensive medical services to ensure senior health maintenance and medical care effectiveness for elderly clients with complex medical conditions. My father is receiving inadequate medical care and experiencing health problems despite Horatio's expensive agency services, explained concerned daughter Archibald to healthcare oversight authorities. He says healthcare complexity requires intensive medical services that cost additional money to ensure proper nursing care and health maintenance. Investigation revealed Horatio had been deliberately providing substandard medical care while collecting agency fees from elderly clients who trusted his healthcare expertise, then reducing nursing staff and medical services to maximize profits while maintaining expensive pricing for inadequate home healthcare designed to create rather than prevent health problems requiring additional intensive medical services and healthcare enhancement. He'd been reducing qualified nursing staff, eliminating medical monitoring, and providing insufficient healthcare while collecting premium pricing for home health services designed to maximize profit margins rather than ensure elderly medical care and health maintenance. The scheme particularly harmed elderly clients needing medical care who trusted professional healthcare services but faced health deterioration through systematically reduced care standards disguised as healthcare complexity requiring intensive medical services and home healthcare enhancement designed to maximize agency profits rather than ensure senior health and medical care quality. When healthcare licensing authorities investigated his agency practices, they found evidence Horatio had provided substandard medical care to over 120 elderly clients while collecting agency fees exceeding $2.2 million. Our 23rd story brings us to Miami, where senior tax preparation specialist Benedictine had been helping elderly clients manage tax obligations and maximize senior tax benefits throughout South Florida for 6 years. She was certified by tax organizations and recommended by financial advisors for her expertise in senior tax issues and ability to help elderly clients navigate complex tax requirements while securing appropriate deductions and benefits for seniors with retirement income and investment assets. Benedictine seemed genuinely knowledgeable about senior taxation and committed to helping elderly clients protect their retirement income through proper tax planning and preparation designed to maximize senior benefits while ensuring compliance with tax obligations and regulations. Benedictine's tax preparation helped maximize my senior benefits and protect my retirement income, shared satisfied senior client Millicent during a tax service evaluation. Her expertise in senior tax issues provided essential tax planning that reduced my tax burden while ensuring I received all appropriate senior deductions and benefits for my retirement situation. But elderly clients started experiencing tax problems and IRS issues despite professional preparation, with Benedictine claiming tax complexity and regulation changes that required additional preparation fees and intensive tax services to ensure senior tax compliance and benefit maximization for elderly clients with complex retirement, income, and investment situations. My tax preparation created IRS problems and penalties despite Benedictine's expensive services, explained frustrated senior prudence to tax oversight authorities. She says tax complexity requires intensive services that cost additional money to resolve IRS issues and ensure proper tax compliance. Investigation revealed Benedictine had been deliberately creating tax problems while collecting preparation fees from elderly clients who trusted her tax expertise, then filing incorrect returns that would result in IRS penalties and tax complications, while claiming complexity required additional payments for intensive tax services and IRS resolution enhancement. She'd been filing false tax returns, creating incorrect deductions, and sabotaging senior tax preparation while collecting premium pricing for tax services designed to create rather than prevent IRS problems requiring additional intensive tax services and penalty resolution enhancement services. The scheme particularly harmed elderly clients needing tax assistance who trusted professional tax preparation but faced IRS penalties through deliberately incorrect tax preparation disguised as complexity, requiring intensive tax services and IRS resolution designed to maximize preparation profits rather than ensure senior tax compliance and benefit maximization. When tax preparation licensing authorities investigated her preparation practices, they found evidence Benedictine had created tax problems for over 70 elderly clients while collecting preparation fees exceeding $400,000. Our 24th story brings us to Portland, where elderly prescription delivery service owner Algernon had been providing medication delivery and pharmacy coordination for senior clients throughout the Pacific Northwest for 4 years. He was recommended by healthcare providers and praised by families for his delivery expertise and ability to help elderly clients access medications while ensuring prescription safety and medication adherence for seniors with complex medical regimens. Algernon seemed genuinely committed to medication access and helping seniors receive necessary prescriptions through reliable delivery services designed to maintain medication compliance while reducing pharmacy travel burdens for elderly clients with mobility limitations. Algernon's prescription delivery helped my father maintain medication compliance and health, shared grateful daughter Cordelia during a delivery service evaluation. His expertise in medication coordination provided essential prescription access that ensured my father received necessary medications while maintaining his health and medication adherence without pharmacy travel difficulties. But elderly clients started experiencing medication delivery problems and prescription errors despite professional services, with Algernon claiming delivery complexity and pharmacy challenges that required additional service fees and premium prescription coordination to ensure senior medication access and prescription safety for elderly clients with complex medication needs. My mother is experiencing medication delivery problems and prescription errors despite Algernon's expensive services, explained worried son Maximilian to prescription oversight authorities. He says delivery complexity requires premium coordination that costs additional money to ensure medication access and prescription safety. Investigation revealed Algernon had been deliberately creating prescription problems while collecting delivery fees from elderly clients who trusted his medication expertise, then providing delivery services that would result in medication errors and prescription delays while claiming complexity required additional payments for premium coordination and prescription enhancement services. He'd been delivering wrong medications, creating prescription delays, and sabotaging medication delivery while collecting premium pricing for prescription services designed to create rather than prevent medication problems requiring additional premium coordination and prescription safety enhancement services. The scheme particularly harmed elderly clients needing medication access who trusted professional delivery services but faced health risks through deliberately problematic prescription delivery disguised as complexity requiring premium coordination and medication safety enhancement designed to maximize delivery profits rather than ensure senior medication access and prescription safety. When prescription delivery licensing authorities investigated his delivery practices, they found evidence Algernon had created prescription problems for over 90 elderly clients while collecting delivery fees exceeding $200,000. Our 25th story brings us to Houston, where Senior Companion Placement Agency Director Imogene had been matching elderly clients with caregivers and companions throughout Southeast Texas for 7 years. She was recommended by social services and praised by families for her placement expertise and ability to help lonely seniors find appropriate companionship while ensuring caregiver quality and compatibility for elderly clients needing social support and daily assistance. Imogene seemed genuinely committed to companion services and helping elderly clients maintain social connections through quality companion placement designed to prevent isolation while providing families with confidence in caregiver selection and companion reliability. Imogene matched my mother with a wonderful companion who enhanced her quality of life, shared appreciative son Thaddeus during a companion placement evaluation. Her expertise in caregiver matching provided essential companion services that reduced my mother's loneliness while ensuring she received appropriate daily assistance and social support from a caring, reliable companion. But elderly clients started experiencing companion problems and caregiver issues despite professional placement. with Imogene claiming screening challenges and companion training needs that required additional placement fees and premium companion services to ensure senior safety and companion quality for elderly clients with complex care needs and social requirements. My father is experiencing companion problems and caregiver issues despite Imogene's expensive placement services, explained concerned daughter Wilhelmina to companion oversight authorities. She says screening challenges require premium companion services that cost additional money to ensure senior safety and appropriate companion quality. Investigation revealed Imogene had been deliberately placing inappropriate companions while collecting placement fees from elderly clients who trusted her screening expertise, then arranging companions with inadequate training and problematic backgrounds while claiming challenges required additional payments for premium companion services and placement enhancement. She'd been placing companions without proper screening, arranging caregivers with criminal histories, and creating companion problems while collecting premium pricing for placement services designed to create rather than prevent companion problems requiring additional premium services and companion quality enhancement. The scheme particularly harmed elderly clients needing companionship who trusted professional placement services but faced safety risks through deliberately inappropriate companion placement disguised as screening challenges requiring premium companion services and placement enhancement designed to maximize placement profits rather than ensure senior safety and companion quality. When companion placement licensing authorities investigated her placement practices, they found evidence Imogene had placed inappropriate companions with over 50 elderly clients while collecting placement fees exceeding $300,000. Our 26th story brings us to Denver, where elderly financial abuse investigator Bartholomew had been providing asset protection and financial monitoring services for vulnerable seniors throughout the Rocky Mountain region for 5 years. He was licensed by financial protection organizations and recommended by elder law attorneys for his investigation expertise and ability to help families protect elderly assets from financial exploitation and elder abuse through professional monitoring and asset protection services. Bartholomew seemed genuinely committed to elder protection and helping families safeguard vulnerable seniors from financial predators through comprehensive monitoring designed to prevent asset theft and financial exploitation by unscrupulous individuals targeting elderly victims. Bartholomew's financial monitoring helped protect my mother from financial exploitation, shared grateful daughter Delphine during a financial protection evaluation. His expertise in asset protection provided essential monitoring services that prevented financial abuse while ensuring my mother's assets remained secure from potential exploitation and financial predators targeting vulnerable seniors. But elderly clients started experiencing financial losses and asset theft despite protection services, with Bartholomew claiming exploitation complexity and monitoring challenges that required additional protection fees and intensive financial services to ensure senior asset safety and financial abuse prevention for elderly clients with substantial assets and vulnerability to financial predators. My father experienced financial losses and asset theft despite Bartholomew's expensive protection services, explained devastated son Genevieve to Financial Protection Oversight. He says exploitation complexity requires intensive financial services that cost additional money to ensure asset safety and financial abuse prevention. Investigation revealed Bartholomew had been deliberately facilitating financial exploitation while collecting protection fees from elderly clients who trusted his asset monitoring expertise, then providing services that would enable rather than prevent financial abuse, while claiming complexity required additional payments for intensive protection and financial monitoring enhancement services. He'd been providing access to financial predators, creating opportunities for asset theft, and facilitating elder abuse, while collecting premium pricing for protection services designed to enable rather than prevent financial exploitation, requiring additional intensive protection and asset monitoring enhancement services. The scheme particularly harmed elderly clients seeking asset protection who trusted professional financial monitoring but faced financial exploitation through deliberately harmful protection services disguised as complexity requiring intensive financial services and asset monitoring enhancement designed to maximize protection profits while facilitating rather than preventing elder financial abuse and asset theft. When financial protection licensing authorities investigated his monitoring practices, They found evidence Bartholomew had facilitated financial exploitation affecting over 40 elderly clients while collecting protection fees exceeding $800,000. Our 27th story brings us to Tampa, where Senior Emergency Response System Coordinator Ferdinand had been providing medical alert and emergency monitoring services for elderly clients throughout Central Florida for 6 years. He was recommended by healthcare providers and praised by families for his emergency response expertise and ability to help seniors maintain independence while ensuring rapid emergency assistance through professional monitoring and alert services designed for elderly safety and emergency medical response. Ferdinand seemed genuinely committed to senior safety and helping elderly clients live independently through reliable emergency response systems that provided families with peace of mind while ensuring seniors could access immediate medical assistance during health emergencies and safety crises. Ferdinand's emergency response system helped my father maintain independence while ensuring safety, shared confident daughter Octavia during an emergency monitoring evaluation. His expertise in medical alert services provided essential safety monitoring that gave our family peace of mind while allowing my father to live independently with reliable emergency assistance available whenever needed. But elderly clients started experiencing emergency response failures and monitoring problems despite professional services, with Ferdinand claiming system complexity and monitoring challenges that required additional service fees and premium emergency services to ensure senior safety and emergency response effectiveness for elderly clients with complex medical conditions and emergency assistance needs. My mother experienced emergency response failures and monitoring problems despite Ferdinand's expensive services, explained panicked son Lysander to Emergency Response Oversight. He says system complexity requires premium emergency services that cost additional money to ensure safety monitoring and emergency response effectiveness. Investigation revealed Ferdinand had been deliberately creating emergency response problems while collecting monitoring fees from elderly clients who trusted his safety expertise, then providing monitoring services that would fail during actual emergencies while claiming complexity required additional payments for premium emergency services and monitoring enhancement. He'd been installing defective alert systems, providing inadequate emergency monitoring, and creating safety failures while collecting premium pricing for emergency response services designed to create rather than prevent emergency response problems requiring additional premium services and safety monitoring enhancement. The scheme particularly harmed elderly clients needing emergency protection who trusted professional monitoring services but faced safety risks through deliberately defective emergency response systems disguised as complexity, requiring premium emergency services and monitoring enhancement designed to maximize monitoring profits rather than ensure senior safety and emergency response effectiveness. When emergency response licensing authorities investigated his monitoring practices, they found evidence Ferdinand had created emergency response failures affecting over 60 elderly clients, while collecting monitoring fees exceeding $400,000. Our 28th story brings us to Atlanta, where elderly advocacy organization director Horatio had been representing senior rights and fighting elder abuse throughout the Southeast for 8 years. He was licensed by advocacy organizations and recommended by elder law attorneys for his advocacy expertise and ability to help protect elderly clients from abuse and discrimination while ensuring senior rights and dignity through professional representation and advocacy services. Horatio seemed genuinely committed to elder advocacy and helping vulnerable seniors protect their rights through comprehensive advocacy designed to prevent elder abuse while ensuring appropriate care and treatment for elderly clients facing discrimination and rights violations. Horatio's advocacy helped protect my mother's rights and prevent elder abuse, shared grateful son Evangeline during an advocacy evaluation. His expertise in senior rights provided essential advocacy services that ensured my mother received appropriate treatment while protecting her dignity and preventing discrimination and abuse from care providers and institutions. But elderly clients started experiencing increased abuse and rights violations despite advocacy services, with Horatio claiming legal complexity and advocacy challenges that required additional representation fees and intensive advocacy services to ensure senior rights protection and elder abuse prevention for elderly clients facing complex discrimination and institutional abuse situations. My father experienced increased abuse and rights violations despite Horatio's expensive advocacy services, explained frustrated daughter Archibald to advocacy oversight authorities. He says legal complexity requires intensive advocacy that costs additional money to ensure rights protection and abuse prevention. Investigation revealed Horatio had been deliberately enabling elder abuse while collecting advocacy fees from elderly clients who trusted his rights protection expertise, then providing advocacy that would worsen rather than prevent abuse, while claiming complexity required additional payments for intensive advocacy and rights protection enhancement services. He'd been enabling abusive care providers, failing to report elder abuse, and sabotaging rights protection, while collecting premium pricing for advocacy services designed to enable rather than prevent elder abuse requiring additional intensive advocacy and rights protection enhancement services. The scheme particularly harmed elderly clients seeking rights protection who trusted professional advocacy but faced increased abuse through deliberately harmful advocacy services disguised as complexity requiring intensive advocacy and rights protection enhancement designed to maximize advocacy profits while enabling rather than preventing elder abuse and rights violations. When advocacy licensing authorities investigated his representation practices, they found evidence Horatio had enabled elder abuse affecting over 30 elderly clients while collecting advocacy fees exceeding $600,000. Our 29th story brings us to San Diego, where senior nutrition counselor Benedictine had been providing dietary planning and nutrition education for elderly clients throughout Southern California for 4 years. She was certified by nutrition organizations and recommended by healthcare providers for her nutrition expertise and ability to help seniors maintain proper diet and nutrition through professional dietary guidance designed for aging nutritional needs and health maintenance. Benedictine seemed genuinely committed to senior nutrition and helping elderly clients maintain health through appropriate dietary planning that addressed age-related nutritional challenges while ensuring proper nutrition for optimal aging and health outcomes. Benedictine's nutrition counseling helped my father maintain proper diet and health, shared satisfied daughter Millicent during a nutrition evaluation. Her expertise in senior nutrition provided essential dietary guidance that improved my father's health while ensuring he received appropriate nutrition for his aging needs and medical conditions. But elderly clients started experiencing nutritional problems and health deterioration despite professional counseling, with Benedictine claiming dietary complexity and nutrition challenges that required additional counseling fees and intensive nutrition services to ensure senior health maintenance and dietary effectiveness for elderly clients with complex medical conditions and nutritional requirements. My mother is experiencing nutritional problems and health deterioration despite Benedictine's expensive counseling, explained worried son Prudence to nutrition oversight authorities. She says dietary complexity requires intensive nutrition services that cost additional money to ensure proper dietary planning and health maintenance. Investigation revealed Benedictine had been deliberately providing poor nutrition advice while collecting counseling fees from elderly clients who trusted her dietary expertise, then providing nutrition guidance that would worsen rather than improve senior health, while claiming complexity required additional payments for intensive nutrition services and dietary enhancement. She'd been recommending inappropriate diets, providing harmful nutrition advice, and sabotaging dietary planning, while collecting premium pricing for nutrition services designed to create rather than prevent nutritional problems requiring additional intensive nutrition services and dietary planning enhancement. The scheme particularly harmed elderly clients needing nutrition guidance who trusted professional dietary counseling but faced health deterioration through deliberately harmful nutrition advice disguised as complexity requiring intensive nutrition services and dietary enhancement designed to maximize counseling profits rather than ensure senior nutrition and health maintenance. When nutrition counseling licensing authorities investigated her counseling practices, they found evidence Benedictine had provided harmful nutrition advice to over 50 elderly clients while collecting counseling fees exceeding $200,000. Our 30th story brings us to Phoenix, where elderly respite care coordinator Algernon had been providing temporary care services and family caregiver relief throughout the valley for 7 years. He was recommended by healthcare providers and praised by families for his respite expertise and ability to provide quality temporary care that allowed family caregivers to rest while ensuring elderly clients received appropriate supervision and care. during caregiver absence periods. Algernon seemed genuinely committed to respite care and helping families maintain caregiving sustainability through professional temporary care services designed to prevent caregiver burnout while ensuring elderly clients received continuous quality care and supervision. Algernon's respite care provided essential caregiver relief while ensuring my mother received quality care, shared grateful daughter Cordelia during a respite care evaluation. His expertise in temporary care services provided necessary family support that prevented caregiver burnout, while ensuring my mother received appropriate supervision and care during our absence periods. But elderly clients started experiencing neglect and safety problems during respite care, with Algernon claiming staffing challenges and care complexity that required additional respite fees and premium supervision services to ensure senior safety and temporary care effectiveness for elderly clients with complex care needs and supervision requirements. My father experienced neglect and safety problems during respite care despite Algernon's expensive services, explained concerned son Maximilian to respite care oversight. He says staffing challenges require premium supervision that costs additional money to ensure senior safety and appropriate temporary care. Investigation revealed Algernon had been deliberately providing inadequate respite care while collecting service fees from families who trusted his temporary care expertise, then reducing supervision and safety protocols to maximize profits while maintaining expensive pricing for substandard respite services designed to create rather than prevent neglect and safety problems requiring additional premium supervision and respite care enhancement. He'd been reducing respite care staff, eliminating safety monitoring, and providing inadequate supervision while collecting premium pricing for respite services designed to maximize profit margins rather than ensure elderly safety and family caregiver relief. The scheme particularly harmed elderly clients needing temporary care who trusted professional respite services but faced neglect and safety risks through systematically reduced care standards disguised as staffing challenges requiring premium supervision and respite care enhancement designed to maximize profits rather than ensure senior safety and family caregiver support. When respite care licensing authorities investigated his service practices, they found evidence Algernon had provided inadequate respite care affecting over 80 elderly clients while collecting service fees exceeding $500,000. Our 31st story brings us to Miami, where senior legal document preparation specialist Imogene had been helping elderly clients prepare wills, powers of attorney, and healthcare directives throughout South Florida for 5 years. She was recommended by elder law attorneys and praised by families for her document expertise and ability to help seniors prepare essential legal documents that protected their interests while ensuring appropriate decision-making authority for medical and financial matters. Imogene seemed genuinely knowledgeable about legal documents and committed to helping elderly clients protect their rights through proper legal preparation designed to ensure appropriate healthcare and financial decision-making during aging challenges and incapacity situations. Imogene helped my mother prepare essential legal documents that protected her interests and ensured appropriate decision-making, shared prepared son Thaddeus during a document preparation evaluation. Her expertise in legal document preparation provided essential protection that ensured my mother's wishes would be respected while providing appropriate authority for healthcare and financial decisions during any incapacity situations. But elderly clients started experiencing legal document problems and decision-making failures despite professional preparation, with Imogene claiming legal complexity and document challenges that required additional preparation fees and intensive legal services to ensure senior protection and legal document effectiveness for elderly clients with complex family situations and legal requirements. My father's legal documents created problems and decision-making failures despite Imogene's expensive preparation, explained frustrated daughter Wilhelmina to legal document oversight. She says legal complexity requires intensive services that cost additional money to ensure proper document preparation and legal protection. Investigation revealed Imogene had been deliberately creating defective legal documents while collecting preparation fees from elderly clients who trusted her legal expertise, then providing documents that would fail to protect senior interests while claiming complexity required additional payments for intensive legal services and document enhancement. She'd been preparing invalid legal documents, creating decision-making problems. and sabotaging legal protection while collecting premium pricing for document preparation services designed to create rather than prevent legal problems requiring additional intensive legal services and document preparation enhancement. The scheme particularly harmed elderly clients needing legal protection who trusted professional document preparation but faced legal complications through deliberately defective legal documents disguised as complexity requiring intensive legal services and document enhancement designed to maximize preparation profits rather than ensure senior legal protection and decision-making authority. When legal document licensing authorities investigated her preparation practices, they found evidence Imogene had created defective legal documents for over 40 elderly clients while collecting preparation fees exceeding $300,000. Our 30-second story brings us to Portland, where elderly grief counseling specialist Bartholomew had been providing bereavement support and emotional counseling for seniors dealing with loss throughout the Pacific Northwest for 6 years. He was licensed by counseling organizations and recommended by healthcare providers for his grief expertise and ability to help elderly clients process loss and maintain emotional health during bereavement challenges and life transitions. Bartholomew seemed genuinely committed to grief counseling and helping seniors navigate loss through professional emotional support designed to promote healing while maintaining mental health during difficult bereavement periods and social isolation challenges. Bartholomew's grief counseling helped my father process loss and maintain emotional health, shared grateful daughter Delphine during a grief counseling evaluation. His expertise in bereavement support provided essential emotional guidance that helped my father heal from loss, while maintaining his mental health and social connections during a difficult bereavement period. But elderly clients started experiencing increased depression and emotional problems despite professional counseling, with Bartholomew claiming grief complexity and emotional challenges that required additional counseling fees and intensive therapy services to ensure senior mental health and bereavement recovery for elderly clients with complex loss experiences and emotional needs. My mother experienced increased depression and emotional problems despite Bartholomew's expensive counseling, explained worried son Genevieve to Grief Counseling Oversight. He says grief complexity requires intensive therapy that costs additional money to ensure mental health and emotional recovery. Investigation revealed Bartholomew had been deliberately worsening grief and depression while collecting counseling fees from elderly clients who trusted his bereavement expertise, then providing counseling that would increase rather than reduce emotional problems while claiming complexity required additional payments for intensive therapy and grief counseling enhancement services. He'd been providing harmful counseling techniques, creating emotional dependency, and sabotaging grief recovery while collecting premium pricing for counseling services designed to worsen rather than improve elderly mental health requiring additional intensive therapy and bereavement counseling enhancement services. The scheme particularly harmed elderly clients needing grief support who trusted professional bereavement counseling but faced increased depression through deliberately harmful counseling disguised as complexity requiring intensive therapy and grief counseling enhancement designed to maximize counseling profits rather than ensure senior mental health and bereavement recovery. When grief counseling licensing authorities investigated his counseling practices, they found evidence Bartholomew had worsened grief and depression for over 30 elderly clients while collecting counseling fees exceeding $400,000. Our 33rd story brings us to Houston, where Senior Activity Program Director Ferdinand had been organizing recreational activities and social programs for elderly clients throughout Southeast Texas for 8 years. He was recommended by community centers and praised by families for his program expertise and ability to provide engaging activities that enhanced elderly socialization and physical wellness while preventing isolation and promoting active aging. Ferdinand seemed genuinely committed to senior activities and helping elderly clients maintain social connections through quality recreational programming designed to enhance quality of life while promoting physical and mental wellness during aging challenges. Ferdinand's activity programs helped my mother maintain social connections and physical wellness, shared satisfied daughter Octavia during an activity program evaluation. His expertise in senior recreation provided essential social engagement that enhanced my mother's quality of life, while promoting physical activity and mental stimulation through engaging community programs and social activities. But elderly clients started experiencing activity-related injuries and program problems despite professional coordination, with Ferdinand claiming program complexity and activity challenges that required additional program fees and intensive supervision services to ensure senior safety and activity effectiveness for elderly participants with complex physical limitations and health conditions. My father suffered activity-related injuries and program problems despite Ferdinand's expensive coordination, explained concerned son Lysander to activity program oversight. He says program complexity requires intensive supervision that costs additional money to ensure senior safety and appropriate activity coordination. Investigation revealed Ferdinand had been deliberately creating unsafe activities while collecting program fees from elderly clients who trusted his recreation expertise, then providing activities that would cause injuries and problems while claiming complexity required additional payments for intensive supervision and activity enhancement services. He'd been organizing inappropriate activities for elderly participants, creating safety hazards, and sabotaging program coordination while collecting premium pricing for activity services designed to create rather than prevent injuries and program problems requiring additional intensive supervision and recreation enhancement services. The scheme particularly harmed elderly clients needing safe recreation who trusted professional activity coordination but faced injuries and problems through deliberately unsafe activities disguised as complexity, requiring intensive supervision and activity enhancement designed to maximize program profits rather than ensure senior safety and recreational wellness. When activity program licensing authorities investigated his coordination practices, they found evidence Ferdinand had created unsafe activities affecting over 100 elderly clients while collecting program fees exceeding $600,000. Thank you for joining me tonight on Drowsy Tales Daily, and may these stories guide you into peaceful sleep with renewed awareness of the importance of protecting our most vulnerable community members from those who would exploit their trust during their golden years. Sweet dreams. And I'll see you tomorrow night for another collection of fascinating Reddit stories designed to help you drift off to sleep.